All right. Uh, Thanks everyone again for taking time out of your busy schedules to join us here for this webinar. A few housekeeping items up front. First of all, this is Ryan Crodel at Valencell, and we're happy you were able to join us today to hear this webinar on utilizing wearable technology and remote patient monitoring scenarios. And we're very happy to have managing partner from OneCare, Jake Levy, with us. But before I introduce Jake, a few housekeeping items. First and foremost, for those of you who don't know Valencell, we make the biometric sensor technology that goes into wearable devices of all kinds, everything from smartwatches to fitness bands to audio earbuds and construction hard hats and patches and a variety of other different form factors and use cases. So one of the things we like to do is highlight those different use cases where sensor technology like ours is being utilized, and this is a tremendous example of that. And in fact, this has been a record-breaking webinar for us already in terms of the number of registrants, which I think is indicative of the interest and the market space and the opportunity here around remote patient monitoring and wearable technology. So a couple other housekeeping items real quick. One of the questions, well, first of all, if you do have any questions, we encourage questions and asking us to dive deeper on any topics that we cover on this webinar. So please do submit those questions through the GoToWebinar control panel, and I will read those questions off as they come in and as are relevant to the topics at hand here. One of the questions we always get is, will the webinar be recorded and will the slides be made available? And the answer to both of those questions is yes. Anyone who is registered for the webinar, and certainly anyone who attends the webinar, will receive an email, usually within 24 hours after the webinar, that has a link to the recording and to the slides themselves. So that will be made available shortly. But without further ado, let's go ahead and dive in. I'd like to introduce Jake Levy, who is a managing partner at OneCare, and Jake's going to dive into his background a bit as we go along and as a starting point here. So without further ado, I'll hand over to you, Jake, and let you take over.
Ryan, thank you very much. Wow, so OneCare is already setting records with this attendance. That's really exciting. I think it does, Ryan, I think it does underscore just how important of a topic this is today. We know that wearables can make a difference, and hopefully by the end of this session, we walk away with some new ideas, probably some more questions, and work towards improving care for seniors. So yeah, so Ryan, I've been in the health technology space most of my career. I've worked in a lot of different care settings, developing electronic health record technology, telehealth technology, mobile health technology. Most of my experience has been focused in working with providers that are concerned with how do we take care of patients outside of a hospital. So, you know, I think that in a nutshell, I think does my background justice. So we'll leave it at that. This is really an incredible audience. We've got folks represented on this audience from technology perspective. We've got providers, we've got payers in attendance, we've got clinicians, physicians, and the other category that I really wanted to highlight early in this discussion is, and this probably affects many of us on this call, is we have caregivers in attendance. And so what we're going to talk about today is something that probably affects a good bit of us on this call as caregivers. Big thanks to our partner, Valencell. So Ryan, thank you. Dr. Steve LaBeouf, the CEO at Valencell, thank you so much. And I appreciate you making this an important topic for what you guys are doing. So today I'm going to cover actually 4 topics. Each of them are pretty sizable, and I'm going to try to condense them down for the short time that we have. The first thing I want to talk about is what are some of these key challenges in healthcare that wearable technology and, more broadly speaking, telehealth, remote monitoring, and so forth speaks to. So we'll talk about the challenges in healthcare. We'll talk about how the wearable technology is applied and how that's being adopted in today's marketplace. We'll take a minute and look at the underlying science behind some of the sensors that are built into our technology. So we'll take a peek at that. And lastly, I'll give an overview of the OneCare Care Watch, which is designed specifically to improve remote care for seniors. All right, so let's advance that. So without further ado, let's start off with healthcare challenges. I've tried to condense this to a single slide, just for time's sake, but I think it's important to recognize that from a population perspective, 56 million Americans are over the age of 65, and that's growing to 80 million by the year 2050. To put that in another perspective, by 2050, 1 out of 6 people in the world will be over the age of 65. According to the World Population Prospectus, this is the first time in 2018, it's the first time that the population of people over 65 have exceeded the population of people under 5 years old. Interesting statistic. The next thing we want to talk about, many of you are familiar with, are the hospital readmission rates. So once again, data came out for 2020. There were nearly 2,600 hospitals paid out $563 million in readmission penalties. And it's interesting, if you break down those numbers, there were 1,177 hospitals that had an increase in readmissions. There were 1,148 hospitals that had a decrease in readmissions, and 342 hospitals, which was the same number as last year, paid out the maximum penalty of 3%. There was a recent article that came out last month. It was a study that was looking at this readmission program. Study was published by Yale Medical and University of Texas Southwestern Medical Center. And what they did is they looked at what critics had been concerned about is that the readmissions program would somehow incentivize hospitals to forego that second admission in the ER and send patients home prematurely in order to avoid readmission risk. So the outcome of this study, that indeed there was no evidence whatsoever that found that that was in fact the case. So that was encouraging to see that. The next thing I want to talk about is access to care. Again, this is another really significant challenge, I think, for all of us that are trying to manage, especially rural health. 10% of our country's physicians work in rural health areas, whereas that's where 25% of our population lives. One of the biggest challenges in this dichotomy is really recruiting physicians to work in rural health. I heard an interesting story recently on NPR was talking about this recruiting challenge. The average medical school graduate, new doctor, will graduate with an average of $300,000 in debt. So you have a population that's coming out of medical school, excited about their career as a physician, facing enormous amount of debt, and very concerned that they can make that up as quickly as they'd like to be able to cover that working in rural health. So that's definitely a challenge. I touched on this one earlier. I think the caregiver burden is a significant challenge. There are approximately 32.4 million caregivers that are caring for somebody ages 50 years and older. That has an estimated economic value of $470 billion. That was a study that came out last year from AARP. And then the last one, obviously, is just the cost of healthcare. So chronic disease patients comprise 71% of a $3.5 trillion US healthcare cost. That number is expected to rise to 20 in 2027 to $6 trillion. So the average cost right now is $11,000 per person. That's going to go up to $17,000 per person. Obviously, that's not sustainable. So I wanted to dig in a little bit on this issue of caregiver burden, because this is really something that OneCare speaks to quite profoundly. This was a study that was published recently by the Center for Advanced Palliative Care, and they asked 500 caregivers a really important question. What's the #1 challenge you're concerned about as a caregiver? And you can see the breakdown here. #1 was, how will my loved one deal with memory loss? What's going to be the emotional toll on myself? I've got great concern for having patience with my loved one. How am I going to handle mood swings, changes in behavior? How do I remain positive? So 82% of these recipients were really concerned about how to have peace of mind. And I think that weighs heavily on caregivers as far as the burden that we bear in taking care of our elders. Personally, I'm one of those caregivers, and I'll talk a little bit about what my journey has been caring for my mother and how wearables have kind of played into that for me personally. So how are we adopting this technology? This is probably the most exciting slide for me, having spent a good bit of my career evangelizing the possibility of telehealth and wearables, and really moving from the theoretical to actually seeing this take shape, and actually people making a move to do this. So in the telehealth market, the annual growth, 19% growth from the year 2018 at $38 billion to an expected growth rate of $130 billion. The wearables marketplace, global market, increasing by 2022 to $70 billion. That's up from $17 billion in the year 2016. Staggering growth. The next, I think, drive to adopting the technology is obviously CMS is now reimbursing for a lot of the telehealth, specifically remote patient monitoring. So according to the CMS fee schedule for last year, the average reimbursement for remote patient monitoring was $165 per patient per month. And I think that reimbursement obviously drives adoption in many different areas, and this is an area that we're seeing quite rapid adoption. The next area of adoption is the physicians. So the level of adoption by physicians, it grew over 340% over the last 3 years. By comparison, if you look at a similar time period at the onset of electronic health records, they had a growth of 69%. So physicians are rapidly adopting the new technology around telehealth. The last thing that's driving the adoption that I wanted to touch on, and we'll go into this a little bit deeper, is really the connectivity. What's happening in Internet of Things, IoT, advancements in cellular technology have really vastly improved the ability to connect wearable devices. This is abundantly important for OneCare, as our device, which I'll get into shortly, relies heavily on advanced technology for built-in communications. Let's go into this a little bit further. So there's two technologies I wanted to talk about briefly. One is LTE-M, also known as the narrowband. From a deployment perspective, we're able to leverage existing cellular towers, so the infrastructure requirements are minimal compared to other new technologies in cellular. Narrowband affords us a much lower power requirement, which translates into extended battery life for these devices. That's something we'll talk about shortly. The other thing that narrowband provides us, LTE-M, it provides us a deeper penetration in buildings, which is obviously significant in the senior care space. and it's also a much lower cost. So typically in narrowband, you're dealing with single-digit megabyte plans versus multi-digit gigabyte plans. So the cost is far less. Some ideal scenarios where LTE-M has a real impact are sensors that track things like sweating and respiration, body temperature, heart rate, blood pressure, SPO, vitals of that nature. The other technology I want to mention briefly, because it will also have a very important impact in the telehealth and the wearable market space, is 5G. 5G requires significant infrastructure upgrades. Estimates are as much as $1 trillion in investment for the carriers to build their networks out completely. The benefit are obviously the speeds are in many cases 10 to as much as 100 times faster than 4G. The latency is as high as 10 times less than what is experienced in 4G. The ideal use cases for 5G are things like physician consults, intra-hospital networks, and then imaging applications like CT, MRI, think about remote robotic surgery, and even being able to equip emergency response vehicles with 5G to rapidly convey critical information back to physicians. So with all this connectivity, one of the challenges we have to be concerned about is the increased risk of security. Quite simply, the more devices that are out there, the more potential points of hacking that we've got to be concerned with. The American Hospital Association had a good article, and they came out with some recommendations to ensure that all devices have very strong security features, passwords, that data is encrypted at rest and in transit, being able to segment out the work so that non-critical devices are not connected to core systems, making sure that there's a adequate inventory and device map in terms of how everything is connected to your network. And last one, and obviously, is have the systems in place to properly monitor any network abnormalities. Our best practices at OneCare have been adopted from the Microsoft Azure IoT Cloud, including IoT Hub. We believe that while there are other cloud platforms out there, we believe that Microsoft gives us best-in-class security, literally infinite scalability with IoT Hub, strong HIPAA and security built into the platform. And this little graphic you see here refers to IoT Hub's secure token system that ensures that every single device on the network has a secure token and it is protected. All right, so let's talk a little bit about the OneCare solution as an example of a wearable device. We're very excited that this is the first wearable device that's actually on AT&T's LTE-M narrowband network. Obviously, there's a lot of different wearable devices out there. There's patches and different implants, continuous glucose meters, and so forth. Our company was established in early 2019. Our technology has been out for many, many years. Our first device was a 2G device. We then developed a 3G device. We made a decision in 2018 to leapfrog 4G and move to narrowband. So we were definitely a pioneer in that space. So let's talk a little bit about our target audience and who are we serving. Obviously, we're serving seniors. We're providing seniors a platform to better manage their health, have a greater sense of security, a greater sense of independence, and an overall improvement in the quality of life. I have definitely experienced this with my own mother, who wears the Care Watch She's probably more engaged in her own health than I've seen her in probably most of my adult life. She'll call me and ask me, did you see my steps today? Tell me how I slept last night. So it's really nice to see her motivation. We're obviously serving caregivers, giving them an opportunity to participate in the loved one's outcomes, providing them the greater peace of mind, reducing burden and strain, and enhancing family engagement. We onboarded a recent patient. The first thing that they said is, how do I get all three of my children on the application? I'd like to share information with them. And that was important for that family. Also, data can serve clinicians to improve caregiver efficiency, provide actionable data if there's a need for an intervention, generate revenue in terms of our business model, and really speaks to the overall management of chronic disease. So let's take a minute to define a little bit more about the product, starting with our technology stack. As I mentioned, we're built on the Microsoft Azure cloud. We are taking advantage of the LTE narrowband. We are certified on the AT&T network, soon to be certified on Verizon. We also have a global SIM that allows us cellular connectivity in over 165 countries across 650 carrier networks. So we're very excited about that capability. We made a point to build in Wi-Fi as a backup. We know that there will be scenarios where cellular communication may not be available. So we're always going to look for a Wi-Fi connection to manage that battery life. If that's not available, we'll use the cellular network. The other thing, and we'll talk more about this in just a second, the watch also serves as a BLE hub, providing connectivity to other devices, built-in GPS, and built-in audio for voice. Our feature set includes the ability to track heart rate, activity like steps and so forth, sleep quality, which we'll talk about that in just a second, fall detection, geofencing. We also use the term safe zone. A built-in SOS alarm that will alert an emergency call center, and of course, mobile apps to support the collection of this information. Data gets collected in a couple of different ways through our web portal as well as our mobile apps. We have built-in integration for other systems, so we absolutely view our wearable device as an ecosystem API that can tie in with other remote patient monitoring systems, which is why we do use the term remote care mobile monitoring. I have a lot of experience working with different remote patient monitoring systems, and there's a number of really good products out there. We recognize that there are limitations with those systems, especially when the patient leaves the house. How do we continue to monitor that patient? So that's an important aspect for us. I think our design is important to highlight its simplicity. So obviously there's a lot of different smartwatches that are in the market today. Most of those watches do depend on another connected device, like a smartphone. Ours does not, of course, and we do that intentionally to try to keep the overall cost of remote connectivity down. But the one thing I wanted to say on this screen is that I've mentioned my mother wears this watch, and she's been wearing it for many, many months, and she loves the device because she can tell time. And I say that a little tongue-in-cheek, but it's a really simple interface for the population that we're targeting. It is designed to be very frictionless and very transparent. So there's no apps, there's no swiping, there's no dial to turn. Just, Mom, wear the watch, enjoy it for what it does. And the real value is all the data that it provides around vital sensors, safety as it relates to safe zone and SOS. All right, so let's talk a little bit about the underlying science. And I want to give credit to our CTO, James Barfield, who is really an expert in the field of algorithms, well published in that space, and we're thrilled to have him on our team. So what you're seeing here is a graphical representation of what our accelerometer is doing. So accelerometers are going to capture a three-dimensional picture of g-forces. That's what we're looking at. So 1g represents the force that we're all feeling of gravity today. So 1g is also representative of 9.8 meters per second, and that's how we measure g-forces. So in this particular incident, you can see that there was a significant change in g-forces, both down and up. This represented 2.5 g-forces. Think of it as an impact that would feel like 2.5 times the weight of your normal gravitational field. So that's an example of how an accelerometer can register data. In our case, we're looking at about 50 measurements a second on a horizontal axis. And so if we pull this down into some actionable event, we can see that with some mathematical formulation, we can pull this into a single graph. So what this tells us is we had a free fall that pulled negative G's. We had a pretty significant impact here, greater than 3 G's actually, and that is going to trigger, obviously, an alarm in our wearable device. So that's how we're going to be able to take all the data points that come through a sensor, whether it's an accelerometer, whether it's a GPS sensor, whether it's a heart rate sensor, activity, and be able to translate that into something that's actually meaningful that we can take action on.
Hey, Jake, we've had a couple of questions come in, so sorry to interrupt, but both questions around regulatory clearance. So one, is regulatory, specifically FDA clearance required? And if so, is the product FDA cleared to provide relevant medical information, SpO2, for example?
Yeah, that's a really, really good question. So at this point, we have what's called an FDA exemption. We are in the process of going through our FDA certification. And so we're not making any specific healthcare claims at this point, but that's definitely a roadmap item. And we expect to have our FDA clearance completed by this year.
And Jake, that may be a good opportunity to talk more as it relates to SpO2, the integration of data from other devices.
Yeah, as a matter of fact, you're reading my mind.
Oh, good segue.
Yeah, so we use the term Bluetooth connected hub, and essentially what we're able to do with this device is we are able to connect to other Bluetooth wearable devices that have a specific Bluetooth profile, and we're able to take that data via a Bluetooth transmission, convert that to a cellular transmission, and move that information over to our care navigation platform, or it could move into Epic or HomeCare Homebase, or really HRS, any other system out there that we have an API with. So examples of Bluetooth monitors that we've already connected to would be kind of the core monitors that you think about in remote patient monitoring. So a blood pressure cuff, a pulse oximeter, a glucometer, a weight scale. But we really have the capability to connect to any wearable device in the home or outside the home that is Bluetooth accessible. One of the more significant items in our roadmap that we're working on right now is building out a much larger catalog of Bluetooth devices, because we think this is really important. We talk a lot about wearables. Unfortunately, many of these devices rely on a third-party connection to actually get the data to where it needs to go. So we do believe the watch is going to solve some really important challenges in terms of fulfilling the true vision of connected health. Ron, did that answer that question?
Yeah, sure did. And in fact, another question has come in about back on the fall detection slide, it asks, can you estimate how serious a fall is and use that to estimate the level of damage on the person who fell?
That is a good question. Mr. Barfield, would you mind picking up on this fall detection since you are the published expert on the algorithm and talk a little bit about how we interpret the data in
sure
terms
thing,
of the
Jake.
severity of the information?
Yeah, so inherently what you're looking at is the magnitude of the acceleration in the second plot. And so there are key identifiers that you might use to do that very thing. So one being how large the impact is. So that's how hard a person actually hits the ground. Another identifier might be how much free fall. So you can tell things like the difference between if a person fell down a flight of stairs, for instance, or if a person fell down on normal ground via the free fall approach there, and you can actually differentiate those types of things. So that is definitely a future sort of development that could be in these products.
Thank you, James. I appreciate the input. And I'll say that I'm glad that we have a mature algorithm in place thanks to your help, because I was feeling a lot of pain testing this for you. So
yeah, sure thing, Jake.
Hey, one more comment about, I think, and not to give away our secret sauce, but I think one of the underlying aspects of our fall detection algorithm is to be able to look at other metrics that we're collecting off the watch. So we can definitely go through our mathematical processes to determine G-forces, but there are other things too that we can look at that are built into our watch that contribute to determining, is this potentially a false detection or was this actually a fall? So nice job with that, James. Okay, Ryan, any other questions? If not, I'm gonna look a little bit deeper into the presentation of information from a mobile health perspective. Okay.
Oh, sorry,
great.
I didn't mean to talk over you, but I'll just reiterate, anyone who does have a question, please submit it through the GoToWebinar control panel. Thank you.
So I wanted to bring up an example of what data looks like. We are a mobile first company in terms of our presentation of data. We built out our presentation in iOS as well as Android initially. We do have a web portal, but we really wanted to speak to this growing trend in mobile health where caregivers and clinicians are not really sitting behind their computers looking at dashboards all day long. So this is an example of a patient record. It tells me who the patient is. It gives me an idea of what the battery life is on the device. Something that I really want to make sure that I get across is, because of the underlying LTM connectivity, it allows us to run at a much lower power. So we have, on average, depending on how you're using the device, but on average, we're at about 6 days of battery life. So my mother charges her watch about once a week, between 60 and 90 minutes, and it's really simple. And I think that's a important factor when you look at wearables. There are other devices that boast of a 15-hour battery life or an 18-hour battery life, and in those scenarios it's hard to manage things like sleep quality. The other thing that we do with this device is we will transmit alerts out to caregivers when the device reaches 20%. We will also transmit another alert at 10%. Anything under 10% will move in low power mode to even extend it further. So here you can see some of the aspects that we're collecting in terms of steps, heart rate, sleep time. We'll dig into those a little bit more deeply here in just a second. Blood pressure, O2, glucose, those are all through paired devices. And then the last is location, which is really important. And I'll touch on that in just a second. So collecting information, coming into the app, how do we turn that into something that's actionable? There are built-in thresholds based on chronic disease as well as specific patients. So my mother, who is a cardiac and hypertension patient, her blood pressure tends to be pretty, well, I'll just say it's on the high side. It's definitely under control with her medication, but her threshold for an alert is a bit higher than, say, someone that is not a hypertension patient. So you have the ability to customize and tailor that. So depending on what the alert is, you'll see that that will show up in the health alert screen. So you see things, abnormal blood pressure, out of area alerts, SOS pushes, which obviously would alert the call center, and other vitals that we would track through the wearable device. And I think that really is, I think that's the punchline. I mean, there's a lot of devices out there that are collecting various pieces of information, but to be able to aggregate all of this together in a single interface and be able to turn that into something actionable, I think is really, really important in moving the needle and solving some of the challenges that we talked about in the beginning of the conversation. Let's take a little bit deeper look. I said we would kind of go into these a little bit more. I just wanted you to be able to see some of the graphs that we can track for heart rate. We do a couple of different things with heart rate, and this is an area, again, on our roadmap that we're moving towards an FDA certification, and we'll be making, more claims in the future. But what is important is we can take a periodic heart rate. You can set a timing of when you want to take that heart rate. So for mom, she takes her heart rate every 15 minutes. If she were not feeling well, there's a continuous mode that will give me that real-time information or near real-time information. In terms of sleep quality, the system is going to keep track of deep sleep, which is green, light sleep, which is blue, and any significant activity is going to show up in red. The thicker the band, the more activity the patient is experiencing or the wearer is experiencing. So for example, a thin band of red might be a little tossing and turning. A thicker band of red is going to likely be someone that got out of bed. I wish I had a picture of my mother's sleep quality about 3 months ago, where for probably 4 or 5 days, she just was not sleeping. She was up and down throughout the night. I actually took her to the doctor, showed the doctor the app and what she was experiencing. And some of you guessed it, she was tested for a urinary tract infection and was positive and resolved the problem with antibiotics. So that's a real outcome that I think is really important, especially for seniors. Sleep quality has such an impact on so many different things. I did want to show a safety feature. So this is an example of a geofence. We use the term safe zone. So you can pinpoint, in this case, I can pinpoint where my mother is in her facility. She is independent. If she leaves, that's okay. I just would like to know about it. Obviously, there are more acute situations where facilities are really trying to manage this themselves. But from a caregiver's perspective, that's extremely helpful.
Hey, Jake, we have had a couple of additional questions come in. One related to sleep, which is, does the wearer have to sleep with a watch to monitor sleep quality?
Yeah, that's a good question. And yes, the wearer does have to have the watch on throughout the night. Let me talk a little bit more about the form factor, because, as I came on board here at OneCare almost a year ago, I wore a Fitbit. And to be honest, it wasn't very comfortable for me to sleep with a Fitbit, and I took it off every night. I can't tell you why. It just wasn't comfortable. It was naturally, I just took my watch off. So I wear the Care Watch. I sleep with it. I don't notice I have it on. There are times that my mother will call me. She has some early stage dementia, and she'll ask where her watch is, and I'll tell her to look at her wrist, and she's wearing it. So the watch weighs less than 2 ounces. It is IP67. It's waterproof. I shower with my watch, whatever I need to do. Enjoy the beach. I'm very active. But yes, you do have to sleep with the device, and we maintain it's extremely comfortable.
Gotcha. Next question is, have you done any validation study on the accuracy of step counts and other physiological measures?
Yeah, as a matter of fact, we did a lot of comparison of our step count to other devices. James is probably more qualified to talk to this, but one of the things that we've done in our algorithm is take into account the senior population that we're serving. James, do you want to talk a little bit about the work we've done in this area in terms of being mindful of sedentary activity and behavior?
Yeah, sure. It's relatively simple in concept, but we err on on the side of detecting senior steps in things like wheelchairs or walkers or those sorts of things. And that was a conscious choice in our algorithm development, so that we can track the minor movements. A lot of pedometers out there might be less sensitive to those sorts of activities versus a pedometer that might be oriented towards the senior population. That being said, we also detect kind of primarily 3 areas of walking, fast walking, and running that you might expect with pedometers. So through extensive testing and comparison to other devices on the market, it remains about the same accuracies in those sorts of areas, but we also included that extra step, at least in the technology planning.
Got it. That's very interesting. Thanks, James. One other question that has come in, and this may be too much under the covers, but I'll go ahead and ask the question and let you decide if it's something you want to answer or not. The question is deep sleep measured by the respiratory rate, or how do you detect the difference?
James, you want to field that? I don't think that's a factor in what we're looking at this point, but I'll let James address that.
I can. At a high level, sleep is based on heart rate and the general activity of the user during the night. So deep sleep is an assessment of being active from just kind of a movement perspective, and then the general area that the person is inactive, because a lot of people will be active when they're not in deep sleep and then go into kind of a less active time. So we are not using respiratory right now. It's definitely something that can be sensed as we progress in the future. It involves quite a bit of science to go down and do that, and it can get complicated. So it's definitely a future sort of thing.
And Ryan, I will add, not to get too much under the covers, but we are working with some of the larger technology companies that have solutions for problems with sleep. So that's, again, that's a very important item on our product roadmap as we evolve the product.
Gotcha. Okay.
So,
sorry, Jake.
No. I was just going to say, this is a wrap-up slide. So let me do this one real quick, and then we'll just open it up. I think my target here, James, was to be in wrap-up mode at around 11:45 Eastern time. So yeah, I just want to say that I really appreciate everyone's time on this call. I think we're all here trying to address a really important challenge in healthcare. I think we all agree that wearables present an opportunity to really move the needle in healthcare and make a big difference in the lives of literally hundreds of millions from a senior care perspective. So I'm really excited about, having spent my career in this space, to be at the point where the technology has advanced so far. So we're very excited about the OneCare platform. It is the most advanced care watch focused on senior care in the marketplace. We offer the highest degree of remote connectivity of any wearable device in the market today, and we're converging, a number of different data points into a single application. And most importantly, we're making the information, we're taking the data, we're turning that into actionable information for the key stakeholders involved in senior care. So that's my wrap-up slide. We did want to leave 10 minutes or so for additional questions, and so I'll kick it back over to you, Ryan.
Thanks, Jake. This has been a great webinar, really informative. I appreciate you covering the topics that you did. I'll remind everyone on the call, please submit any questions that you have through the GoToWebinar control panel, and we'll go through those as they come in. A few other questions have come in already. One is around the GPS and the safe zones. Is the GPS always active in the watch? If so, how do you manage the autonomy since GPS consumes quite a bit?
That's a great question. Yeah, that's a very knowledgeable person that asked this question. So you're absolutely right. GPS is the largest consumer of power on the device, even more so than the cellular chip. So we have a optimization method that allows us to control the timing of when the GPS is taken and the timing of when the watch communicates to the server. So again, don't want to give away too much of the secret sauce here, Ryan, but I'll tell you that we've put a lot of thought into optimization of power, even in terms of our display and how that works. So if you have a situation where you're monitoring a senior that is a risk of wandering, you might adjust the settings as such. My mother is not a wanderer. I don't take her GPS as frequently as, say, I would have wanted to have done with my father. So throughout the application, we have looked at all of the different sensors that we're utilizing and the data that we're capturing in the context of power management. And so we really believe that that battery life is one of the bigger, if not biggest, challenges in being able to make use of these wearable devices. The last thing we want to do is tell a senior, wear this great device, make sure you take it off at night and charge it. So, thanks, Ryan.
Yep, and we've had a couple of questions, actually more than a couple, come in around your business model. So what's the business model? How are you making money? What are the price points? And more around who are you selling to and how's the distribution working?
Yeah, great questions. Continues to evolve. I can take those questions more specifically on a one-on-one basis, so feel free to reach out to me. But let me answer it by saying we have a moderate purchase price for the watch, and then we have a monthly monitoring fee. There's a couple of different levels of monitoring. There's a professional monitoring, which is going to send emergency alerts, SOS, and falls to an emergency call center that will respond to that. We also have a caregiver model that is designed for caregivers and family members, and that is a little bit less. So it's a recurring revenue model. We also have a distribution agreement that allows organizations that want to provide this to their population of seniors. It affords them a wholesale pricing model, which is why earlier I did make the comment that this is a revenue generator from a B2B2C perspective. And we will have our e-commerce model launched in the very 1st of April so that people can buy the watch independently. We really believe that over the last year and a half to 2 years, it was important to really work in that enterprise model with the key providers that we had access to, really perfect the model.
Got it. Yeah, that makes a lot of sense. Next question is around adoption rate. So how is wearable adoption by seniors? Is it age or gender specific?
Well, it's gender specific only because women are living longer. So when we are in these facilities, we are typically finding that the wearers are going to be more female than male. So we definitely are seeing that. I don't know that age is as much of a factor as cognition is. The other factor that I think is really important is what sort of caregiver engagement does the wearer have. So we had one pilot a while back where they brought the watch into a memory care facility, and I will tell you it was difficult. It made sense, but there were seniors that their level of cognition made it very difficult for them to wear the device. So it's not designed as an ankle bracelet. It is, it's a watch, and there's probably things that we can do from a band perspective to make it a little more difficult to take off. But what we learned from that experience is having to coax someone into wearing a device that each time they were approached, they were somewhat confused by it or didn't want to wear it. So, I think where we are right now with this device is probably more appropriate in its current form factor for individuals that have a higher degree of independence, and most certainly have the support of a caregiver or a family member to reinforce the connectivity. And I don't mean that from a technology standpoint, I mean that from a personal standpoint of caring. So the last comment, my mother is so motivated to wear the watch because she knows that I'm connected with her, and she's kind of proud of it. And it is a little bit of a talking point when she's at meals and people are asking, what is that? And she talks about how, her children are able to stay in touch with her and see how she's doing. It's a good question.
Cool. Yeah, great questions. Keep them coming. Next one is blood pressure measured via a connected device or by the watch itself?
Great question. Today, blood pressure is done through a third-party connected device. As you would imagine, OneCare continues to evolve and work with various sensors as they become available. So we're well aware of other avenues to collect blood pressure, but right now, given the fact that I think accuracy is still in question, we've made a decision to really leverage our BLE hub capabilities to interface with other FDA certified devices.
Gotcha. Next question. This also may be too much under the covers, but I'll go ahead and ask it and let you decide whether or not you want to answer. It is, what specific medical device classification is OneCare seeking to obtain with the FDA?
If you'll contact me directly, we'll talk more about the FDA process and what our plan is.
That makes sense. Next question. This one also maybe I'll let you decide whether you can answer it or not. Is AT&T marketing the device for you?
That's a great question. AT&T has been an absolutely phenomenal partner, and we have a very strong business relationship, and they have a very strong desire to go to market with this device. We have not enacted a specific AT&T sales plan, but if I'm being honest, and this is not to sound braggadocious or boastful, we have a number of carriers that want to market this device in one form or fashion, but we can't say enough positive things about AT&T. We are not obligated to work with just a single carrier, and I did mention we've got a great relationship with Verizon. It's a hell of a team there as well, and we'll look forward to having a certified device come out with Verizon in the next quarter.
Great. Next question is, have you had cases where patients accidentally activated the SOS button?
Yeah, it can happen. There's a way to cancel it. There's kind of a balance between making it easy for them to do so and minimizing the false SOSs. Let me go back here. So you'll see here is our SOS button. So it does require the wearer to hold that button down for, I believe it's 5 or 6 seconds. So you've got to be pretty intentional to hit that button. But look, with any of these devices, any of these trackers, devices designed for safety, false alerts is really, I mean, that goes with the territory. That's part of what we have to take into account in our technology model. So I won't say it happens often, but it is possible.
Gotcha. Okay. In the interest of time, we've got about 2 more minutes left, and there's quite a few questions. So I want to be respectful of everyone's time, particularly yours, Jake. I really appreciate you taking the time to do this. We've had several questions come in about reimbursement, which generally fall under, do you believe the device is eligible for remote patient monitoring reimbursement under existing Medicare policy?
Yeah. It's a good question. It's something that obviously we've looked very closely at. One of the requirements for reimbursement is the device needs to be FDA cleared. So that's pretty black and white. We do believe it adds value in the context of a remote patient monitoring platform where we're transmitting data from other devices. So for example, there's a few different health systems that we've worked with that are trying to stand up blood pressure programs to manage pre and postpartum moms, looking at pregnancy-induced hypertension. So, the challenge is how can they quickly get the readings back on those blood pressure devices? So that would be an example paired with an FDA blood pressure device where the provider, the physician, would be eligible for reimbursement under 99-457, as well as 99-454. There's a new CPT code, which is an extension of 99-457, came out this year, 99-458, which is designed to better support chronic disease patients with subsequent blocks of 20 minutes.
Gotcha. I think we've probably got time for one more question, and that's it. I'll just go ahead and read the question. And you may have already addressed this, but just in case, what is the average charging time for the watch?
Yeah, it's 60 minutes. So my charge, it ranges between 60 and 90 minutes, but an hour is plenty. That's a full charge. Depending on the use of the device, you're off and running for an average of 6 days. And I will say, and this is a minor detail, but it's an important detail for the senior population. We have a cradle charging approach. So the watch just sits into a magnetic cradle. It's kind of form fitted, so it only fits one way. And when the senior gets the watch close enough, the magnet will snap and the cradle will come together. And it's very easy to do that.
Got it. Okay. We are over the top of the hour here. So again, I want to be respectful of everyone's time and go ahead and wrap up. I know there were additional questions that came in, and we will address those questions directly with the people who asked them. So thanks for your patience with that. And really appreciate all of the great questions that were submitted. It always makes these much more interesting to keep an open dialogue here as much as possible in this webinar format. So thanks for that. Thanks again for attending. And Jake, thank you and James for taking time out of your busy schedules to do this. This has been really informative and very much appreciated.
Ryan, thank you for Valencell and its team to put this on. And I really want to thank the audience. Great questions, and look forward to seeing you guys at HIMSS and other events throughout the year.
Sounds good. Thanks, Jake, and thanks everyone.
Have a good day.